And here is what has been happening with the type of consultation. These gray ones are face-to-face consultations, the yellow ones are secure emails, and the blue ones are telephone calls. So the number of email consultations are increasing and number of face-to-face consultations are decreasing. And the patients can decide in which way they want to consult, and they clearly want to use more email. And the total workload for the physicians has actually decreased and not increased in Kaiser Permanente. There is a great potential for tools like video conferencing. Actually, you will be able to make home visits virtually. You can use the television set and a webcam, and you can communicate with patients. You can visit your patients, even the hospital ward, or then even rural practitioners can take part in CME events very easily. So this is very near in the future. Also, the patients are online all the time. Even in the hospital, they are using their own health records, and they are communicating with their carers. Even they can share the electronic health record during encounters in the examination room. There's a recent commentary in JAMA, that was June 12, about how to use EMR together with patients. And in Finland we have developed a national care plan which is used in the chronic care model. And this care plan is filled in together with the patient. It is actually the patient who dictates the words in the care plan. He names my health problems are, my goals are, and then the professionals only support, and even the wording there is from the patient. And they look at the same screen during encounters. And the next step is that patient can record their own data and include it in the same database. They can record their history, measurements, blood glucose, ECG. You can even measure your ECG using your iPhone nowadays, pain intensity, their functioning. They can also check whether their medication list is correct. They can check whether their diagnosis list is correct. In NHS, there is a service called NHS Direct, and check your symptoms. You can describe your symptoms, fill in a questionnaire, get self-help advice, make appointment, and even in the future get a prescription on the basis of what you have entered. In Finland we have just started a trial where you can get a prescription for urinary tract infection without even a phone call, just sending your data via the internet. We are also starting in Finland what we call virtual health check and health coaching. You can fill in a questionnaire about your lifestyle, many questions, then you can get a report, what's your life expectancy, what are your risks, how you could decrease your risk for some certain conditions, and then you can get personalized advice according to your replies, what to do with sleep, stress, management, alcohol, and so on. And then you can start a virtual health coaching program. You can use a mobile app with your cell phone or email, and you can send data daily or weekly. You can get a virtual coach which gives you feedback, how to exercise, what kind of advice you need, and you can get that feedback once a week or so for 12 weeks. And we have several programs like this for many symptoms and many chronic conditions. Then we come to clinical decision support. There was a recent systematic review how reminders work in EHR systems. And one of the findings, well, I think the main finding is that reminders are not so very effective. Just a few % of improvement in process measures. But one determinant of success was that if the same reminders, same advice was provided simultaneously to physicians and to patients themselves. So then compliance with the advice was much better. So this is the way how we are developing the decision support service in Finland now. We have professional recorded data in the electronic health record, we have patient recorded data in the personal health record, and then we have this interactive care plan which collects all the data, communicates with the decision support service, and then gives personalized advice directly to the patient and also to the physician. What's required from the infrastructure to make all this work? We need coded national summary data. That's one topic for the next presentation. Patients need access to their electronic health records. There must be a secure communication safe way, for instance for email and easy data entry. And there must be a toolkit available so that GPs can coordinate the care. How to make this in the IT architecture? Every system must have a self-care component, and there must be a PHR to be able to use all the nice apps that have been developed. Separation of data and applications is important. So if you have a very comprehensive system like Epic in the US, you still should have the database. All the data should be in a database where it can be accessed with different apps and different tools. And one of those apps, or several apps, would be those self-care apps. This is an important principle in planning systems. So finally, we can see electronic health services as part and overlapping with other services like travel agencies and banking. So there is overlap. And then there is a user interface for professionals, and there is a user interface for citizens for these services, and much of this user interface is actually the same, and the data all these services use are the same. Thank you.
Okay, some questions for a few minutes.
Thank you. That was very provocative and nice. Can I ask the Duodecim, this software that you're referring to, is this belonging to the Finnish government, or is it to the Duodecim or the college?
Well, it is many of these tools here, and particularly this tool is developed by the Medical Society at Duodecim, but then it is licensed by the regions, not by the government, but the doctors need to not pay for these tools. So it's the municipalities and the regions who pay the license for the tool, and it's the EMR vendors who integrate these tools. So this is the model we try to promote in Finland, that the data should be accessible by different tools via nationally agreed interfaces.
Other questions? Okay. All right.